Now, let's look at what's involved in a total hip arthroplasty. Before your surgery, you'll need a physical exam, lab work, other tests to make sure the surgical procedure is safe for you. You may decide to donate your own blood before surgery to reduce the risk of needing a transfusion from the blood bank. You may attend a class to teach you the skills you'll need after surgery. And you'll meet with an orthopedic nurse to answer any questions and sign the surgical consent. Finally, call the working day before your surgery to learn what time to check in. The night before surgery, carefully cleanse the hip area using the provided cleanser. Some people will also start taking a blood thinning pill called Coumadin to help reduce the risks of blood clots after surgery. Finally, don't eat any food or drink any liquid after midnight unless you received other directions. It's the day of surgery and you'll come to the hospital. You'll meet with someone from anesthesia. You'll have a general or spinal anesthesia. You may also have an epidural anesthesia, which may keep you more comfortable after surgery. Surgery will take between 1 and 2 hours. Then it's on to recovery for about an hour and finally to your hospital room. The first night after surgery can be quite painful. Ask for your pain medication as the anesthetic begins to wear off. But remember, the medication will not relieve all of the pain. Its purpose is to make the pain tolerable without making you too drowsy. Side effects from the medication can include nausea and itching. If this occurs, tell your nurse so she can give you medication to counteract this. You may also request an ice pack to assist with your discomfort. During your stay in the hospital, you'll learn how to protect your new hip and avoid risky movements. You'll learn exercises to improve your strength and increase your endurance. Do these 6 exercises at least 2 times daily after resting in bed. The best formal exercise for after surgery is deep breathing. Breathe through your nose, lifting both arms overhead at the same time. Breathe out through your mouth, lowering both arms at the same time. The next exercise is a gluteal set. Squeeze your buttocks together, hold for 5 seconds, then relax the muscles and start again. The next exercise is a quad set. Lie on your back with a small towel rolled under the knee that is on the same side as your hip surgery. Press the back of your knee into the rolled towel and hold for 5 seconds. Then relax the muscles and start again. The next exercise is an ankle circle. Lying on your back, slowly move your ankle that is on the same side as your hip surgery in a circular motion. The next exercise is a hip abduction. Lie on your back with your legs straight up and your toes pointing straight up. Slide the leg on the same side as your hip surgery out to the side as far as you can. Then slide the leg back to its starting position. You may need some help with this for 2 to 3 weeks after surgery. The next exercise is a straight leg raise. Lie on your back with the leg that was operated on straight out and the opposite leg bent. Tighten your top thigh muscle and raise the leg that was operated on, keeping your toes pointing up. You may need assistance with this exercise for 2 to 3 weeks. Performing these exercises is an integral part of your recovery. Your goal is to slowly work up to 20 repetitions of each exercise. Strengthening the muscles that were weakened during surgery will help you return to normal activity and promote healing. You'll also begin to stand and walk, as well as learn safer ways of doing daily tasks. As with any major surgery, there are some precautions you'll need to follow to avoid injury to your new hip. Until you're totally healed, your hip will have a limited range of motion. Some movements will strain your new hip joint and cause the ball to slip from the socket. Here are a number of precautions you should follow for at least 6 to 8 weeks after surgery. When you sit, always keep your back upright and keep your knees level with or below your hips. Don't let your surgical leg cross the midline of your body. Instead, sit with both feet on the floor with your knees 6 inches apart. Don't plant your foot and rotate your new hip. Instead, turn both your feet and body. Don't bend at the waist when either standing or sitting down. Instead, use a device such as a long handle device to reach objects without bending. Therefore, don't bend more than 90 degrees at the hip. To lift yourself up from a chair, use the chair arms, not your hands placed on the seat of the chair. Don't sit on any low toilets or chairs that put your knees above your waist. Instead, use a raised toilet seat or chair that allow your knees to be level with or below your hips. Don't stand with your legs crossed. Instead, stand with your legs slightly apart and your toes pointed straight ahead. Practice these precautions before surgery to develop the skills and habits to make your recovery easier. 2 to 3 days after surgery is discharge day. At home, you'll need to sit and move the way you were taught in the hospital. Remember the precautions to prevent dislocation. Practice walking every day and try to do more each week. But don't put more weight on your new hip or walk without a walker or crutches until your surgeon tells you that it's okay. Continue doing your exercises. Remember that life won't be easy at first. You may want to get some help from family members or friends for a time. But you should be doing as much as you can for yourself because this will speed your recovery. But think before you move. Finally, you may use crutches, a walker, or a cane for 6 weeks or longer. Your surgeon or his staff will tell you when you can walk without assistance. For some, recovery from hip replacement surgery can take longer than others. Remember, every patient recovers at his or her own pace. Listen to your surgeon and his staff and follow their directions.